Hello and welcome to our channel. My name is Anne and today I have Shinto with me, who is one of the OET trainers at LangFort International Academy. And yes, we are with a role play video. And today Shinto will be playing the part of the patient and I will be the nurse. Before we move on to the video, I would like to give you the scenario. Well, this is taking place in the ENT department and the nurse is talking to a 30-year-old patient who has been scheduled for a surgical removal of a retention cyst from the throat the next day. She is here to outline the pre-assessment test for the surgery, but seeing that the patient is extremely worried, she addresses the concerns first. So let's see how it is done. So Shinto, are we ready?
Yes, we are.
All right then.
LangFort International Academy. Your passport to the world of opportunity.
Good morning, my name is Anne and I will be your attending nurse today. Before we start, can I check with your name and age?
Yes, my name is Shinto and I'm 30 years old.
Thank you. As I understand from your case notes, you are scheduled for a surgical removal of a retention cyst from your throat tomorrow. Am I right?
Yes, that's right.
Alright, thank you for the confirmation, Shinto. So I'm here to outline the pre-assessment tests that are to be done before the surgery. But before I move to that, I noticed that you're extremely anxious. May I know what's bothering you?
It's the surgery actually. The doctor did mention that it's a small procedure, but it's a bit overwhelming.
Oh, I do understand your anxiety, Shinto. I would say it's quite natural to feel apprehensive when it comes to surgical procedures. However, I would like to assure you that there's no need to be alarmed about it and we will take care of you at every step. And I would also like to tell you that everything is going to turn out right. And right now, I want you to be relaxed. Did you get me?
Yes, I do get you.
Okay. Could you tell me more about your worries and fears regarding the procedure?
Well, I'd like to know if the procedure is going to be painful, how long the procedure will take, and how long the recovery will take.
Well, these are reasonable questions from your side, and I would like to address them one by one. First, regarding the pain, well, you don't have to be worried about it because this is done under the anesthesia, so you will not experience any pain during the procedure, but you might experience mild pain after the surgery. Well, that can be, effectively managed with medications. Now, coming to the procedure time, well, you were already informed that it is a small and simple procedure, so approximately it would take 30 to 45 minutes. Right? Now, finally, regarding the recovering period, well, healing is rapid, so you will feel better in, say, 4 to 5 days. Does it make you feel better?
It certainly does.
All right. So, do you have any other queries?
Well, I would also like to know what would have caused this.
Oh, certainly, I would like to explain that for you. So, when your salivary gland ducts rupture, the saliva or water spills into the neighboring connective tissues, leading to inflammation or swelling. These fluid-filled sacs are harmless, but it could be quite uncomfortable. And usually, it goes away on its own in 3 to 6 weeks. And the possible cause could be a trauma to the mouth or face, like getting hit on the face or a head-on collision. Are you able to relate to any such incident?
Actually, yes, I was in a motorcycle accident last year. It was a head-on collision and it was pretty bad.
Oh, I'm really sorry to hear about the accident and I'm glad that you recovered. But right now I can sense that you are a little confused. What is confusion?
Well, I'd like to know if I actually need the surgery.
Well, I would like to explain that for you. So, Shinto, your cyst is growing, and that is why you are facing difficulty in swallowing and speaking. So, if it is left untreated, the growth can affect your breathing as well. So, the ideal solution is removal of the lump, and that has to be done surgically because it's quite large now. And let me assure you that it is the best option because it can prevent recurrence. Does that clear your doubt?
Yes, indeed it does. As you know, I was a bit apprehensive about the surgery, but now you have cleared my doubts.
All right, I'm glad that I was able to do it. So that being said, do you have any other question?
Well, I'd also like to know if I should be hospitalized for many days.
Well, you don't have to stay in the hospital. As a matter of fact, you will be discharged the same day after the observation period. But then you will have to come back the next day for a review. Is that okay?
Yes, that'll be fine.
Okay, do you have anything else? Would you like to ask me anything else?
No, I guess I'm good.
Alright, so Shindo, what I'd like to do right now is I would like to tell you about the assessment tests that you are to do before the procedure. Like you will have to take a blood test and an ECG test just to make sure that your general health is quite good before the surgery. So shall we proceed with those tests?
Yes, sure.
Alright then, thank you so much. I'll be back in a few minutes and we will take the blood sample from you. So till then, just be relaxed, okay?
Yes.
Alright, thank you. Well, that was the end of the role play and I hope it went really well, right, Shinto?
Yes, it did.
Yes, okay, so let us know from the comments and don't forget to like, subscribe and share. So till then, with another video, I will see you soon. Till then, it's bye from Shinto and Anne. Bye-bye, take care.